Hello, I'm Julie Scott. I run a clinic here in Essex called Facial Aesthetics, and I'd like to just talk to you a little bit today about a treatment that we offer in clinic for those small thread veins to the face, and that's called Thermavein therapy. Thermavein is a treatment that's clinically indicated for something called telangiectasia. That's the technical term, but to most of us, small thread veins. And they can be little thread veins on their own or a cluster of thread veins, which can be called spider veins that have a little pinpoint and the little veins coming off it. But basically little fine thread veins to the face that tend to affect the cheeks, especially around the nose area and sometimes on the chin. There's no one cause for thread veins. They can be hereditary, they can be caused by environmental issues, so that may be that you've had a lot of sun exposure through photoaging, or just the elements if you're outdoorsy and you're working with the elements and the wind and etc, so that can also contribute. There is a definite hormonal link with the cause of thread veins, and that's why we tend to see them predominantly in females, but males do come to our clinic with them as well. So there's not just one cause. We see a lot of them in patients that do suffer with rosacea and sometimes acne as well. So there's never really one cause. It's often a mixture or one or the other, but yeah, they're very common. When patients come in, they feel a bit embarrassed about them, but I always say to my patients they're incredibly common. So we use a machine in clinic to treat these small thread veins called Thermavein. How does it work? I'm going to keep it really simple. It uses energy, so a high frequency wave is emitted through the machine, and it comes all the way down a lead and hits a little pencil instrument that we use with the machine, and once it hits the needle's nickel, and it creates heat within the needle nickel, and it's actually the heat that is transferred to the small, very thin vein at the surface of the skin, and once that heat hits that vessel, it creates heat within the vessel and the blood clots. It's called thermocoagulation, or solidifies, if that works with you better. So essentially the blood has closed down in that vessel, and then that little kind of area of clot gets reabsorbed back into the body. So it's very specific, very targeted, and very safe for only treating the vein and no surrounding tissue. So it's thermocoagulation. What can you expect when you come into clinic for this treatment? Okay, so first things first, numbing. I do like to put some local anaesthetic cream on my patients because this is, as my patients put it, an annoyance type of pain. It feels like a prickly type of pain. Some patients are fine without numbing, but I offer it. So that's the first thing that would happen in clinic, the offer of that, to make it as comfortable as we could make it for you. Then obviously we go through all the paperwork, etc., like you would with any treatment. And then we clean the skin thoroughly to make sure there's nothing sitting on the skin that could bring infection into the skin. And then we start the treatment. Treatment's quite fast in clinic. It's one of those treatments you don't want it to last long, so we need to work through it fairly quickly. And it involves lots and lots of tiny little needle injections. It's very fast. After the treatment, the skin will feel quite warm and it will be very red, very normal, and we've created heat within the skin, so you would expect that. Straight after treatment, I put a lovely cooling gel onto the skin to help calm the skin down and bring comfort to the skin. And then you're sent away. So you're here pretty much an hour all in all. We don't rush it, but it's quite a straightforward, fairly quick treatment once we start treating you. A little bit of discomfort, managed with a little bit of local anaesthetic cream and a calm approach. We take our time, but that's kind of what you can expect from a Veinwave treatment. Veinwave is an instant treatment. So when I hand the mirror to patients after I've treated them, I say, see past the redness and just look at where your thread veins were. And it's always really interesting because they hold them around and they go, oh, they've gone, which is just a lovely feeling for me when I'm practicing and treating patients. However, we've created all this thermal heat within the skin. We've created trauma to the skin because we've done these little tiny injections. Therefore, there's going to be a healing stage. So that initial redness and heat that's in the skin, that goes down very quickly in a matter of hours. However, the healing has to continue for several weeks. So I always say to my patients, pretty much by the next day, you can put makeup on, that's no problem. But for the coming week to 10 days, the skin looks, I call it patchy. You can feel those kind of uneven areas where I've treated, maybe a little bit of redness still left in there, not that red intense heat, but a little bit of pinkness to the skin. And that can take a couple of days to settle down. And then after about a week to 10 days, you can kind of touch your skin and you can feel those ultrafine, I describe them as cat scratches, where I've gone in with a little needle, but that's all to the touch. And then I say to patients, for us to see the best results, we're looking at about 6 to 8 weeks when it's really settled, all the tissues underneath have settled as well. And that's when I bring my patients back to clinic and we look to see, has any of them come back? Have you sneezed and we've treated around the nose and it's re-purged into that area? Were there any that we missed at the first appointment? So some patients, if they've got a small number of areas, will only need one treatment. Some patients that I've got a lot of condensed areas across both cheeks, for example, may need 2 or 3 treatments. So when you come in for a consultation, we can talk and look at your own individual needs, and then we can guide you as to how many treatments you may need. I've been doing Veinwave treatment now for nearly 15 years, and it's one treatment in my clinic that I see patients every week for. So there's a big demand because it's a very common problem. The benefits that I would say of Veinwave is that it's quick, you see the results straight away, it's a very successful treatment. But for me, the most specific and probably the biggest benefit that I can see an advantage to this treatment for this type of problem, as opposed to perhaps other treatments, maybe laser, is that it's very specific. So with Veinwave, we are just targeting where the area is, rather than any possible surrounding tissue being damaged. It's a huge self-esteem booster for patients, because lots of people have these treatments and a lot of people associate negative connotations around thread veins. Some people say to me, oh, Julie, you know, people might think I'm a boozer because I have a red nose with thread veins, and that's obviously a myth. But it really is, you know, for somebody's self-esteem to be able to resolve that is very positive for your patients. If somebody's got something that very fair skin and you know, your eyes are drawn to those red areas, it's quite upsetting for some patients. So the benefits definitely outweigh any of the uncomfortableness whilst during the treatment that they incur. Yeah, it's a fairly low risk, straightforward treatment for this type of condition. Like any treatment, there's always going to be a clinical indication. And over the years, I have had some patients coming to me and saying, oh, Julie, could you just get rid of this vein? And I look and say, no, that's kind of vital. That is a vein. Veinwave is only clinically indicated for these tiny little veins that come to the surface. So there's certain veins that it can't treat, and there's other treatments for those types of treatments. Personally, I don't feel that Veinwave is the best treatment for leg veins. Again, there's not really a clinical indication for that. There's other treatments for that, and there are sclerotherapy, microsclerotherapy, lasers. So there are definitely some patients that aren't clinically indicated for Veinwave, and we always then refer on if we feel that Veinwave isn't going to be the best treatment for patients.